Hello, everyone around the world. Welcome to this special event on social safety nets and COVID-19. Can we protect food security and nutrition? This is part of IFPRI's COVID-19 virtual event series. You can find out more on IFPRI's COVID resources, analyses, and numerous blogs at our COVID Spotlight page at ifpri.org, or just Google IFPRI and COVID-19. I'm Dan Gilligan, Deputy Director of IFPRI's Poverty, Health, and Nutrition Division, and I will be moderating this event. We'd like to thank you for joining this virtual event live, and thank you to those of you who are watching this recording after the event. We're eager to hear from you. To participate in our Q&A session that will follow the brief presentations, please submit your questions on ifpri.org, Facebook, LinkedIn, YouTube, or by using hashtag AskIFPRI on Twitter. For our friends from the media, if you have any specific queries or questions, please feel free to contact our media team. Their contact details are available on ifpri.org. So let's get started. The COVID-19 pandemic and subsequent lockdowns have created twin health and economic shocks that are staggering in their breadth and scale. While the pandemic has arrived later and slower in many lower and middle income countries, COVID-19 is threatening the lives and long-term livelihoods of millions of poor people, with estimates indicating that COVID-19 could increase extreme poverty below $1.90 a day by 70 million to 100 million people. Gains made in the fight against poverty, food insecurity, and malnutrition in this century are threatened, requiring a vigorous policy response. A centerpiece of that response has been an expansion of social safety nets. Many countries have provided beneficiaries with additional cash or food transfers and have added new programs during lockdowns or requirements for social distancing. Past IFPRI research shows that social safety nets can help limit further harm among vulnerable populations by bolstering food security and assets, and with the potential to protect child nutrition with effective program designs. This expansion of safety nets during the pandemic also faces significant challenges, including how to safely deliver food and cash transfers without increasing virus exposure, how to target newly vulnerable households, and how to adapt program designs to promote the food security of households and protect child nutritional status. Today, we'll hear about how social safety nets have been used to respond to COVID-19, the extent to which this response has addressed food security and nutrition, and opportunities and challenges going forward. Our speakers will provide a global overview, as well as profile the implementation experience and research evidence from Bangladesh and Ethiopia. These are two countries with extensive social safety net systems that IFPRI and its partners have studied for many years. We have an exciting program lined up for you. I'd like to call on Frank Place, Director of the CGIAR Research Program on Policies, Institutions, and Markets, for some opening remarks. Frank?
Thank you very much, Dan. I am pleased to provide a few introductory remarks for today's seminar on social safety nets and COVID-19. Can we protect food security and nutrition? Social protection is one of the main research themes in the Policies, Institutions, and Markets program because of the importance of social protection in meeting fundamental sustainable development goals on reduction of poverty, hunger, and malnutrition. I commend the many governments around the world who are strengthening their safety net systems and the many development agencies and organizations who contribute to their implementation. I equally appreciate the keen interest that they have shown in learning how to make their programs better by reaching the right people, delivering the right form of transfers, and attaining the results that they desire to see. Scientists that are associated with the PIM program that I am the director of have been active participants in evidence generation on social protection programs and innovations. They have worked closely with governments in Asia, Africa, and Latin America, and with major international organizations such as the World Food Program and World Vision International. These collaborations are often in the form of long-term partnerships, such as with governments in Bangladesh and Ethiopia, countries that are featured in today's seminar. Social safety nets are important in all countries and at all times, but play a particularly important role in times of crisis such as we now face. It gives me great pleasure that PIM has co-organized this event with IFPRI, and I look forward to hearing the insights from this excellent panel. So back over to you, Dan.
Thanks, Frank. Thanks very much. Our next speaker is Ugo Gentilini. Ugo is the global lead for social safety nets in the Social Protection and Jobs global practice at the World Bank. Ugo, over to you.
Thank you very much, Dan. Thank you everyone for organizing this great event. Maybe if we could start directly from the next slide, please. I think there is little doubt that we are in the middle of one of the largest social protection scale-up efforts in modern history. One metric of that is just looking at the number of countries that have planned or introduced social protection measures in response to COVID, and that number has quadrupled in just a couple of months. You'll see on the left side of the map on the left side that includes about 45 countries. In late March, they increased to over 190 in our latest update on country responses, which is May 22. We're going to come up with another update tomorrow. Next slide, please. While it's coming out tomorrow, I still want to give you a preview of some of the numbers that we're going to present. And as of Tuesday of this week, we have 988 measures that are introduced as a response to COVID. And you can see that they keep growing even 2 months after we started tracking the measures. And those measures have been growing tenfold since late March. Next slide, please. We also went back at the database and looked at to what extent, oh, sorry, here is a little bit of proportion. Most of the social protection response is social assistance, about 60% of it. And about half of that volume includes cash transfers. There is a lot of action also on social insurance, including unemployment benefits, paid sick leave, but also in the labor markets, especially wage subsidies. Next slide, please. In terms of specific food security and nutrition-oriented measures, we went back to the database and were able to identify about 150 measures in 96 countries. So about 15% of global measures are related in some way to food consumption, to nutrition, and to food security objectives. Next slide, please. Overall, we see that countries are adapting their portfolio to COVID in several ways. They're making it easier for countries to access benefits. They're increasing generosity. They're increasing the scale. And overall, those adaptations tend to benefit about 1.7 billion people in terms of social assistance. If we just look at cash transfers, those tend to benefit in those different ways: generosity, coverage, and administrative simplification, about 1.1 billion. And if we just look at coverage of cash transfers, that's over 900 million people. Next slide, please. So just a little bit more on cash. The coverage of cash transfers at the moment is on average 12% of the population in the survey countries, but it can go down to 2%, for example, in the case of Africa. They tend to be pretty generous, more than double the amount that was provided before COVID, but short term, less than 3 months in provision. Next slide, please. And in terms of spending, I think that is generally in line with the level of spending that we saw in 2009, 2010, with the difference that that's overall spending at the end of the overall crisis. So we are probably here still at the beginning, and that amounts to about 0.6% of global GDP, but spending per capita can be pretty low. You could see in Africa, Middle East and North Africa, and South Asia is about $4 to $5 per capita. And for continents and regions like Africa, you'll see that they have the same level of spending as other two regions like MENA and South Asia, but they have almost double the level of undernourishment than regions like the Middle East. Next slide, which is my last one. I think we are all grappling with this question. Is this augmented action in social protection, is it a bubble, or is it helping to shift social protection provision towards a new equilibrium? We are gathering a lot of data, but we are also trying now to get deeper into some of the design and delivery choices that countries are taking, and also starting to move from documentation of action to actual performance. And of course, the extent to which those programs contribute to food security and nutrition is a central question, and very much look forward to the discussion in the panel and from the audience. Over to you, Dan.
Ugo, thank you very much. I thought it was interesting that you said that only about 15% of programs currently have a food security and nutrition focus. I'm expecting that as the pandemic moves even faster into poor developing countries, that's going to have to expand. Thank you. Our next speaker is Mamoon Rashid. He is a program and policy officer at World Food Program in Bangladesh. Mamoon, welcome, and over to you. Mamoon, you're muted. I'm not hearing you. How about now?
Hi, thank you, Dan. Bangladesh has a rich history of implementing social safety net programs, and World Food Program has been working closely with the government on the design and implementation of some of its social safety net for several decades. To respond to the coronavirus pandemic, government's approach is to combine new benefit with an expansion of several existing social safety net programs. For example, a one-time cash grants of $30 has been targeted to 5 million families who are out of social safety net coverage and unemployed due to COVID. And programs such as disability allowance have been expanded and universalized. The government has identified those new beneficiaries and verified their information using their national ID numbers and transfer cash benefit using mobile wallet to reduce risk of transmission. I will share two examples where WFP has been supporting to the government in modifying large-scale social safety net programs that assist vulnerable households with pregnant and lactating women and children nationwide. Next slide, please. So first, we have supported government to modify national school feeding program. Since the outbreak of coronavirus, we realized that nearly 3 million children stopped receiving fortified biscuits due to school closures. Last month, WFP, along with Ministry of Primary and Mass Education, developed a guideline to distribute take-home rations of the nutrient-fortified biscuits. Our partners at the grassroots level supported government in reaching the families while maintaining the necessary precautions of transmission. Each children received 50 packets of biscuits for 2 months. Next slide, please. We have also working with the Ministry of Women and Children Affairs in implementing Mother and Child Benefit Program, under which pregnant women receive monthly cash grants of nearly $10 per month, along with nutrition counseling for 36 months. So before coronavirus, pregnant women self-enrolled by visiting a local Union Information Service Center if they feel that they meet the eligibility criteria. Now, amid coronavirus, we have simplified the process where women can send an SMS with their national ID number and mobile wallet information to the center for online registration, which then verified and approved by the local authority. And following this management information system, the next month, government transferred the cash grants to those women. In this particular program, we have also redirected food rations that were actually purchased as part of IFPRI's planned pilot research under this program. Although the research was postponed due to COVID-19, we didn't want the food to go to waste during this critical time. So we have already distributed the food basket to over 3,000 pregnant women from 4 families under this program. So we learned from these 2 examples that it is possible to reach out to vulnerable household either with food or with cash if we have system in place. And we also observed that nutrition and access to diversity of food for those households remain challenged due to the market disruption. It is also challenging to distribute perishable foods like fruits, vegetable, or animal source food. As a result, household diet are moving to more staple foods such as rice. Although some efforts are underway to address this, as I mentioned, the fortified biscuits that we are provided as take-home rations through the school feeding program contains 15 types of micronutrients. And the food that we have provided to pregnant women under Mother and Child Benefit Program, we also have the fortified rice, which contains 6 micronutrients. And WFP is also working with government to initiate some efforts so that we can send nutrition messages using mobile phone as well. So these are some learning from Bangladesh. So thank you, and back to you, Dan.
Mamoon, thanks so much. Those are really interesting examples of adaptations from Bangladesh. I was particularly interested to hear about attempts to use technology to reach households to provide transfers and potentially to provide some nutrition messages. So that's wonderful. We're going to continue with our example in Bangladesh and bring in Akhtar Ahmed. Akhtar is Senior Research Fellow in the Poverty, Health and Nutrition Division at IFPRI. Akhtar, welcome, and over to you.
Thank you, Dan. Coronavirus has taken a serious toll in Bangladesh. So how can we use social safety nets to address challenges from COVID-19? Next slide, please. Next slide, please. Thank you. There are extensive social safety nets in Bangladesh, and IFPRI has conducted decades of research in this area. One example is a randomized control trial called the Transfer Modality Research Initiative, or TMRI, which was designed by IFPRI and implemented by WFP. The research asked, how can we design safety net to reduce household poverty, improve food security, and enhance child nutrition? TMRI assessed which would be most effective: cash, food, or combining one of these transfers with a nutrition behavior change communication, or BCC. After extremely poor women received program benefits for 2 years, the results showed that any kind of transfer, cash or food, significantly improved food security. Moreover, among children of women who received cash plus nutrition BCC, stunting reduced by 3 times the national average decline. Not only that, but 4 years after TMRI benefits stopped, we see that transfers plus BCC sustained improvements in food security. Next slide, please. Now, how can we ensure a safety net continue to protect food security and nutrition during COVID-19? Coronavirus has highlighted major gaps in the country's safety net system, mainly overlooking the urban poor. So what does our research say what we need to do? While markets are disrupted and in-person contact is restricted, there must be free distribution of food to households in urban slums or urban low-income areas, including some nutritious, non-perishable foods such as nutrient-fortified rice and pulses. In the medium to long term, food vouchers for nutritious food could be distributed to the poor, which use the normal food marketing system and eliminates the cost of commodity handling. Also, a nutrition-sensitive cash transfer program could be designed and implemented, including the in-person behavior change communication, if possible, or through mobile phone messaging. Next slide, please. What else? We can identify and scale up programs that research has proven effective. For example, IFPRI's evaluation of major public works program in Bangladesh found that they are very well targeted, largely because they require manual labor in exchange of cash or food wage. Although these programs have mostly stopped due to the outbreak, the government can make them unconditional safety nets for existing beneficiaries until the situation improves. So no extra cash, food, or listing of beneficiaries are needed to do this. In closing, research suggests that there are many opportunities to improve food security and nutrition through safety nets that require minimal additional effort. I mentioned just a few of the many ways to reach those goals or to reach those poor. Thank you, and over to you, Dan.
Thanks, Doctor. Thanks very much. Those are really excellent examples. Great to hear the evidence from IFPRI research about how to bring ADAPT programs for nutrition, and also the benefits of dropping conditionalities for now during the crisis. So thanks very much. I'd like to remind all of you watching online that you can submit your brief questions on IFPRI.org, Facebook, LinkedIn, YouTube, or by using the hashtag AskIFPRI on Twitter. We'll be coming to the Q&A session soon. So we're going to shift now from Bangladesh over to have a couple of examples and hear a bit more about Ethiopia. Our next speaker is Tigist Mamo. Tigist is the SPEAR Project Health and Nutrition Technical Lead for World Vision in Ethiopia. Tigist, welcome, and over to you. Tigist, I'm not hearing you. Can you unmute?
Sorry. Thank you, Dan. This is a social safety net program in Ethiopia, and we are working with the government to strengthen the PSNP for institution and the resilience. Next slide. Next slide, please. The PSNP program in Ethiopia is a flagship program, and it is significantly contribute to the reduction of poverty in the rural Ethiopia, reaching over 8 million food insecure families. But if the COVID-19 is going to affect the poor family, the effect will be gonna be high. So in cognizant of this, the government of Ethiopia adopted the PSNP program, and in terms of trying to continue to reach the targets beneficiary population. Next slide. Next slide, please. And the adoption of this safety net program by the government Ethiopia are some of, I picked some of the adoption, the key adoption. They did safe and timely transfer and advance payment. Actually, the COVID-19 risk is increased when the people are get together, and then the transfer site is the people were coming together. So by keeping the precaution measures and like hand washing and using sanitizer and personal protective device, and also keeping social distancing, they are transferring to keep safe them, and to make them able to have enough amount of food for their families. They are giving them the cash timely without affecting their time, and they also give them advance payment. The second one is they exempt from the public work. Public work, the public work participants should do something like participate in the productive development programs, but in case of in response to COVID-19, they changed the way they do the public work. In some cases, if there is no the public work, if it's not requiring number of people, they can do that. But if it requires a large number of people, they just exempted from public work all the participants without affecting their entitlement, and the transfer will be continued for them. And the next one is the government enforced the social distancing and other preventive precautions or practice in public gathering places such as in market, churches, mosques, and different places. And the other modification is done in livelihood transfer support. This should be reduce congestion and the rise of market price by using different alternative markets in different places. And the other one is shifting the public work behavioral communication to the home visit awareness raising. Home health extension worker and volunteer go home to raise the awareness of the people how to prevent themselves from COVID-19. And the other one is currently they are also providing top-up to support the pregnant and breastfeeding women and female-headed household in the urban PSNB program. The one I already stated is rural PSNB program. The next slide. Next slide, please. SPEAR, to support the government adoption of in response to COVID-19, SPEAR also made some of the program adaptation, like facilitating advanced transfer via distribution of 2 months of ration, one at a time, without changing the amount and the composition of the food. We are giving them cereals, pulse, and oil to support the nutrition component, and we're also providing them the same amount, giving them double distribution, 2 months at once. We already given the first one, and we're also planning to give for the next one. And the other one is a capacity building in response to the COVID-19, the government staff capacity building in COVID response, as well as in psychosocial support. And we're also supporting the home visit nutrition counseling, added the precaution measures, and we're also working on improved hand washing facilities and practice at public place and households. Previously, we were doing it at household only. Next slide, please. Next slide. The SPEAR programming also helped the participant to be resilient and better prepared for COVID-19, the opportunity of introduction of saving and loan access for the participant during our work before, and also the wash and nutrition message, and also improving access of nutritious foods through vegetable gardening and improved breed poultry, and community-based participatory nutrition promotion. This is the homegrown feeding of children, and also promoting simple hand washing facility at household level. This part of the program supported the PSNP claim to better prepare and resilient for effect of COVID-19. Thank you.
Thank you, Tigis. That's really wonderful. It's interesting to hear about the adaptations of the program, the PSNP, the Productive Safety Net program in Ethiopia in this last round, in the last few years, had a stronger nutrition focus. So it's interesting to hear that as the public work programs and those nutrition meetings were stopped, they found other ways to try to get the nutrition messages to families. Thank you. So next I'd like to go over to Jessica Light. She's research fellow in IFPRI's Poverty, Health and Nutrition Division, and she's going to talk further about evidence from Ethiopia. Jessica, over to you.
Thank you, Dan. So we at IFPRI have been working with World Vision to evaluate the effects of SPEAR over the last 2 years, and I'm going to share some findings today related to the COVID shock. Next slide, please. So in 2019, last year, following about a year of SPEAR implementation, we analyzed short-term effects of World Vision's programming in a sample of about 3,000 rural households. And this graph shows one of the outcomes we examined, whether the woman, the lead woman in the household, reports any savings. And the first three bars, T1, T2, and T3, are all households that were exposed to SPEAR programming, receiving different combinations of L*, which is Enhanced Livelihoods Program, and N*, an Enhanced Nutrition Programming. And the final column, T4, are households that were not included in SPEAR, but they are PSMP beneficiaries receiving base PSMP services. And what we can see here is that SPEAR had effectively stimulated a huge increase in reported female savings. So women exposed to SPEAR, between 60 and 70% of them reported savings, compared to only 30% in the final group, which is approximately a doubling of the savings rate. Next slide, please. Here's another piece of data from our 2019 survey. Again, this is pre-COVID evidence about the effects of SPEAR, looking at asset accumulation by the household, specifically poultry. So SPEAR has had a substantial emphasis on accumulating animal assets through a number of different programmatic components. We can see here that particularly for households in the first two groups who were exposed to the Enhanced Livelihoods L*, there was a substantial increase in the reported number of poultry owned to between 5 and 6, compared to only about 2 in the final arm of PSMP beneficiaries. So the number of poultry assets at least has about tripled due to SPEAR programming over the first year. Next slide, please. More recently, as of June 1st of this year, we've been reaching out to the same households in a phone survey to collect some short-term data about the effect of COVID-related shocks on their household. So we've surveyed 700 households to date. This is data from the last 10 days. You can see we started by querying them about the trajectory of their household income over roughly the last 3.5 months since the period of lockdowns began. And we see overwhelming evidence that households have been seriously affected. So 80% of the households we've surveyed thus far report a decrease in income. And in the right column, we collected information about how they're coping. So what are the mechanisms that they're using to confront this decline in income? The most common, as you see, about 40% report that they are selling assets. And other very common mechanisms are receiving assistance, reducing consumption, relying on savings, and engaging in additional activities to generate income. So given the evidence I just showed, this seems particularly important because we know that households already exposed to SPEAR have both built up savings and built up their asset stocks. And evidence suggests they're now leaning on those mechanisms to confront the short-term decline in income that they're facing now because of COVID-related disruptions. Next slide, please. And finally, we've also posed our respondents a very simple question about their current stress level, whether it's between 1 and 10. And you can see here that a strong majority, so about 60%, report a maximum level of stress about 3 months into this intense COVID period. So while not surprising, this suggests that the decline in income, the use of coping mechanisms, and other disruptions are exerting a serious toll on households. And this may be a channel for longer term effects on welfare and nutrition, particularly for households that have young children in the house. So moving forward and looking towards our longer term data collection, once we're able to survey households again, we're particularly interested in understanding what the effects of these short-term coping mechanisms are, and whether SPEAR as a program has assisted households in buffering themselves against shocks related to the COVID crisis. Thank you very much. Back to you, Dan.
Jessica, thanks so much. Really appreciate to hear more about the evidence on the effectiveness of the SPEAR project and how it's helped households prepare or be better able to weather the shock of the pandemic. At this point, we'll now move to the Q&A portion of the program. We'd like to hear from as many of you as we can, so please be brief with your questions when you type them in the chat box or using the hashtag #AskIFPRI on Twitter. And please feel free to share your name and institution or where you're writing from when you send in your question. I'll read one question at a time, and the relevant speaker will respond. I'll alert the speaker to let people know which one I'd like to answer the question. Please note that in some instances, and in the interest of time, we might have to consolidate some of your questions. And if another speaker has a point to add, they should just unmute and just jump in. So thank you. Let me bring up then the first question. Ugo, this is a question for you from Marites Tionko. She asks, how can we make social safety nets more sustainable? So based on the evidence that you've seen, Ugo, with the large run-up in social safety net programs, what should we be thinking about sustainability here? It relates to your comment about whether this is a bubble or could be longer lasting. Over to you, Ugo.
Thank you, Dan, and that's actually an excellent question. What we are seeing so far is that those programs out there are being financed in a sort of an emergency mode. I think the IMF has done some great work in categorizing how those programs are financed, including tapping state reserves, contingency funds, and other ways. So as things get better, it'd be important to look at more sustainable ways of financing. There are many ways and options out there. I think in principle, looking at the connection between energy and social protection might be an important one, especially kind of the energy subsidy reforms, especially now that energy prices are relatively low. One could look at how to better link, especially in fragile states, the humanitarian and the social protection agendas in ways that enhance coverage, but also make those provisions more sustainable, better connecting domestic resource mobilization and social protection provision from the get-go. So those are all, I think there is an important agenda out there in looking at those options, but it's also important in terms of mindset in approaching the question as there is a real cost for social protection, but it's also very important to look and demonstrate the economic multipliers and the benefits that stem from those provisions. International evidence shows multipliers between 0.8 to up to 2.6. So cash that goes to people goes into the economy. So it's very important also, as one looks at the options, also looking at the benefits that may stem from those transfers.
Ugo, thanks very much. The next question is for Octar. This question comes from Anastasia Crespo, Project Innovate Newark. She asks, is there a difference in efficiency or impact on those in need between direct cash transfers or direct food distribution? I wonder if you could comment on that based on your evidence from Bangladesh. Just remind you to unmute, Octar.
Okay, so differences between direct cash transfer and direct food transfer, we have, as I mentioned in my presentation of this TMRI, we did not see really a difference there. Food and cash transfer both are effective in terms of improving household level food security, but just alone food transfer or cash transfer do not have impact according to our evaluation of several safety net programs in Bangladesh. Alone cash or food do not improve child nutrition. So there you need to do something else. And what our TMRI showed that combining cash or food with nutrition behavior change communication can really make a difference. So to answer the question, yes, both food and cash are quite effective in terms of improving household level food security. Thank you.
Great, thanks, Octar. The next question is for Tigist. This question comes from Melkamu Abdisa. The question is, do you believe the shifts in nutrition BCC sessions, the behavior change communication sessions, will be effective via home visit by health extension services. And maybe you could comment about how those sessions are being carried out in the midst of COVID when social distancing is needed.
Okay. Previously, this session was done at the public work site. Maybe the people, maybe 200, from 30 to 200 sometimes. So because of the COVID or the risk of infection, this is changed, already stopped, and changed to home visit. The home visit is more stronger than the public work one, because the health extension worker as well as the voluntary is doing the home visit at home level, and they give private space to discuss their barriers and also encourage them or help them to negotiate with their solution for that specific problem. It also gives more opportunity to discuss about the male engagement issues during these home visits than the group public work. And the follow-up is done by, in our area, in a SPIR area, we are following with community health facilitator. So it is, so far, it's going well. But in case of the government, most of the supervisors are shifted their activity to COVID response. So I don't know whether that is effective or not at this time.
Okay, thanks, Tigis. Thanks very much. Next, I want to come to Mamoun. This is a question for you. So could you please speak more about the nutrition mobile messages that you mentioned? So what kinds of messages are being sent and how are those being targeted?
Yeah, thank you, Dan. Actually, the nutrition messages were disseminated in a courtyard session earlier in the community. But after outbreak of COVID, we have stopped organizing those courtyard sessions. So our field worker at local level, they are communicating the nutrition message with the households that we earlier shared. So, and also it is important, I mean, the household who doesn't have mobile phone, or even the household who have mobile phone, but the owner of the mobile phone, if he is out of household, that's really difficult to communicate on the message. So the message we have usually disseminated using the mobile phone is on the dietary patterns, and also the information on COVID, the sensitivity as well, and also what additional diet they need to include during this COVID time as well. So thank you. Over to you, Dan.
Thanks, Mamoun. Thanks very much. So the next question I'm going to ask, I'm going to actually put this both to Jessica first and then to Akhtar. This question comes from Melcam in Canada, and it's this. So for programs the programs that we're discussing here, have there been gender analyses done? And if so, how has this informed how those programs are carried out? So just wondering, starting with Jessica and then over to Akhtar, if you could talk about gender components of the research and how some of those findings have helped the program.
Sure. So for SPEAR, we've certainly invested a lot of time and energy into analyzing gender components. So for example, I shared some findings about female savings, specifically at midline. That was a case where we saw SPEAR was stimulating female savings specifically. There was no comparable effect for male savings. So that of course benefits the household, but we also believe it has benefits for women's empowerment and their influence within the family. We also have looked at asset stocks for both men and women and found that, again, SPEAR was effective in not only increasing the total asset stock for the household, that's the result that I showed, but had a disproportionate effect on assets owned by females. One area where we found that the gendered effects were perhaps less positive was that men still seem to dominate the process of marketing. So when assets are sold, that is often a process and the associated income controlled by men, because that's what our findings showed last year. So that's a lesson that we were able to share with the program in order to enable more reflection on how to encourage female participation in marketing. For the short-term COVID effects that I spoke later in the presentation, that's only our first survey, and so we've been only reaching men on the phone. It's more challenging to collect data from both men and women in a single phone call, but we're hopeful that in future rounds, we might also be able to reach women in these households and collect more information about gendered effects. Back to you, Dan.
Thanks, Jessica. Thanks very much. Akhtar, I wonder if you could also comment on gender dimensions of the lessons.
Yes. Yeah. Okay. So again, I can go back to this TMRI example that I provided. The program was targeted to women. Extremely poor women. And actually, in Bangladesh, most of the safety net programs are targeted to women, except there are some exceptions like this WORKS program called Employment Generation Program for the poorest, which is a cash-based public works program. There is a quota for women, and that's about 30% women. But other programs are mostly targeted to women. Now, in terms of impact, what we found that this TMRI, cash, food, and BCC, that work that we did, we found that this gender-based violence or intimate partner violence was reduced by 54% even 4 years after the program stopped. So in 2018, we saw that effect, although the program stopped in 2014. So that is a remarkable achievement, and that happened only for the the component that combined cash with behavior change communication. Thank you.
Akhtar, thanks very much. Ugo, I'm going to come to you next. This is a question from Sikandra Kurdi at IFPRI. Sikandra asks, how strong do you expect support to be from the World Bank and donor community for expanding social safety net programs in developing countries in response to COVID?
Well, for the World Bank, it's very strong. I think there was now a well-known announcement of 160 billion for that, and a large share is going for enhancing safety nets. So we see that in a number of countries, some countries were already supported during the first phase that was more health related, but we see more and more countries that will receive support as part of this kind of second phase of COVID response. One interesting aspect, I think, is that we know a lot of what governments are doing and how they are planning to introduce or expand their existing systems. We know probably a little less on how programs are being supported by non-state actors in the whole humanitarian agenda. I think there is some interesting work that CALP and UNICEF and others are doing to start also mapping out that. And that, I think, would nicely dovetail what we know now in terms of what governments are doing. And together, they will provide a fuller picture of what's going on at country level, as supported by the government and by their partners.
Great, thanks, Ugo. I have another question now I'm going to bring to Tigist first, and then to Mahmoud. So we get an example from a response from Ethiopia and a response on Bangladesh as well. The question is from Mace Salatre. Sorry, apologies, Salatre. The question is, targeting beneficiaries is crucial so that no poor families would be left behind, and also to avoid leakage. So in the context of COVID, how does Ethiopia and Bangladesh manage this concern? So maybe you could talk a bit about what you're aware of in terms of new effects on new approaches to targeting during COVID. So we'll start with Tigist. Tigist, over to you.
Okay. In case of those poor who are left from the PSNP target, the government is well prepared by creating food bank. There are different banks who are prepared in this time throughout the country for those poor who are affected by COVID-19. They are going to be benefit from that food bank. Currently, even they started for those of the people who are working as daily laborer and who lost their labor and who lost their job, and also who lost their some of their incomes as well as their assets. They are giving and distributing this food from the food bank, and they also preparing themselves for the worst case scenario by targeting as well as providing those food from the food bank. This is apart from the PSNP program. The PSNP program is distributing all the components like the cash they are giving in advance, and also the food component who are giving the NGOs and other government who are providing food. They are giving double distribution to reduce the exposure of the claimed for PSN for the COVID infection. But apart from this, the government also preparing the food bank.
Great, thank you, Tigist. Yeah, over to Mahmoud.
Yeah, thank you. I mean, it is always challenging to targeting in such scenario. But as I mentioned, that government approach is to combine new benefit with the existing expansion of existing program. So what we observe in Bangladesh that government has identified the beneficiary who are out of social safety net program by using technology. And this time we have observed that government is using the national identity number database and also using the mobile registration information, so that the people who are out of social safety net coverage can be reached with this process. But having said that, I think it is also important to connect with other social safety net program as well. Like government is also implementing open market sale programs. So that's also a part that where large people who are out of this process can also access to food during this critical moment. Yeah, thank you. Over to you then.
Thanks, Mahmoud. Jessica, I have a question for you. It's coming in from Dr. Phil Church. He's based in the United States. He says, in terms of COVID-19 coping mechanisms, he's wondering about asset sales and distressed asset sales, and whether we're seeing that, and whether we should, that should be a concern. So in particular, do we know whether households are selling productive assets? And what do we anticipate in terms of impact on long-run household resilience as a result?
Sure, that's a great question. So as I shared in the graphs showed, we see, given our preliminary evidence, that the sale of assets is in fact the most common coping mechanism that households report. So among households that are losing income, which is almost all households, about 40% of them report that they have sold assets. We do not know in this survey what type of asset that was. It could be a durable good, but I think it's likely, especially given that these are very poor households, that many are selling productive assets. goods because they're unlikely to have substantial stocks of household durables or other goods that would be sold. So I think it's absolutely true that it raises really important questions about long-term effects. On the one hand, selling assets may mean that households can buffer themselves from severe declines in consumption. That's particularly important for households with young children, where a short-term decline in consumption could have very significant effects for growth. On the other hand, it may mean that their pathways for accumulating further assets and kind of a positive income trajectory in the coming months may be severely limited. I think that's an effect we're hoping to track more once we're able to conduct a larger scale survey. And I think it'll also be a challenge for programmers once kind of longer term, less emergency programming can resume to attempt to address any kind of asset deaccumulation that's happened during this COVID shock. Back to you, Dan.
Great, thank you, Jessica. So the next question is for Akhtar. The question is from Bele Mengesha from FAO in Ethiopia. But I'm going to ask you to comment for your work in Bangladesh. So most social protection interventions focus on rural areas. Is there any experience or plan for urban poor social protection in the midst of the pandemic?
Yes, there are over 100 social safety net programs in Bangladesh, and only 2 or 3 programs are implemented in urban areas. So the urban poor are mostly left behind. So there, I think I would say that, one of the most promising programs for urban poor would be to introduce a school feeding program in the secondary schools. And now, what Mr. Mamunur Rashid from WFP explained, the school feeding program, and that is for primary schools. In Bangladesh does not have a school feeding program in secondary schools. So there is an advantage that secondary schools are, there are separate schools for boys and separate schools for girls. Primary schools are co-ed. So if this school feeding program can be implemented in particularly in urban areas, but also in rural areas where nutritious school meals could be provided to these adolescent girls. And we know that adolescent nutrition is very important. Now, I would also suggest that go one step further to add a cash transfer, targeted cash transfer with the school feeding program targeted to the girls from poorer families. So that way it and that should be conditional upon not getting married while they are in school. So we see that in secondary schools particularly, girls dropout rate is very high, and the main reason is they drop out because they are married off by their families. So if this cash transfer also gradually improves by grade, higher grades will get higher amount of transfers, then that can contribute to this preventing of early marriage of girls. We know that early marriage is a big problem in Bangladesh, particularly for the poor families. And early marriage is related to early childbirth, and that in turn actually gives this result is low birth weight children, which is the main cause of stunting. So through this type of program, safety net can actually contribute to some extent to reduce this early marriage. We have already seen, due to COVID-19, there are evidences that families are pressurizing their girls, particularly teenage girls, to get married. And there are several instances that many poor families, the girls are getting married at teenage. So So this type of, I think, social protection has a role to play in that respect. Thank you.
Thank you, Akhtar. I appreciate it.
This is Hugo. Do you
Yes.
mind if I chime in on that question as well?
Nope,
On the
that's
urban
excellent, Hugo. Please go ahead.
Okay. No, I think it's really an important one, and I think there are a number of long-term trends that really point to how poverty is urbanizing, on how urbanization in contexts like Africa and elsewhere is unfolding rapidly, but without generating the high productivity jobs that we have seen historically elsewhere, which in part explains the proliferation of informal settlements. And overall, we haven't yet seen a shift in social protection, in extending coverage, building on the lessons from rural areas also to urban areas and to the urban poor. And this is something that I think the current crisis has shed light on how on the so-called midst and middle, and how large shares of informal workers that don't qualify for social assistance but cannot afford social insurance either tend to be widely in urban areas, in rural areas as well. But in urban areas, their vulnerabilities are really exposed through the crisis. So I think there is a big agenda there. We counted about 24 programs a few years ago that operate in urban areas in terms of safety nets, about 13 now. And but there is a big agenda on adapting to urban areas. Replicating rural approaches won't work. Countries that have tried it, Mexico, Colombia, even parts of India, show that really you need to think of what is a household, how do you reach mobile populations, how do you make a program attractive to people that face high opportunity costs, and how you connect that with housing and urban jobs. So there is a big agenda there, and I think it's one of the key takeaways from this crisis, actually, to strengthen the role of social protection in urban areas.
Hugo, thanks very much. I appreciate you coming in, and encourage the other speakers at any point to do the same. That's really helpful. Mamoun, I'm going to bring this question to you. The question is from Mahedi Hassan at USAID in Bangladesh. How can we engage the private sector in social safety net programs? So I wonder, from your experience at the World Food Program, whether you can comment on whether WFP has tried to work with the private sector, whether you're aware of other initiatives to try to take advantage of public sector linkages. Thanks.
Yeah, thank you, Dan, and thank you, Mehdi, for your interest. I think there are a lot of opportunity to work with private sector in social safety net. Particularly, I mean, if you look at both the cash and also the food transfer process, in both process, private sector has a very important role. Currently, number of mobile financial agency who are engaged in disseminating and transferring money from government to beneficiary. So that's a area where there is a lot of works need to do. I mean, for an example, I mean, in such COVID situations, the women usually come to the mobile financial service providers to receive cash grants. So that's also an opportunity if private sector also includes some COVID or some health or some nutrition message during this type of transmission, so that beneficiary really get number of information from that source. On the food supply, I think from production to marketing and transportation, there are opportunities that private sector can engage, can add significant value into the food system process, and also support in fortification of many foods as well. Like, for example, WFP is working with many private sector in fortification of rice currently, and number of agency is collaborating with government and WFP to fortified staple rice, oil, and those has been evaluated elements from private sector point of view. So yeah, Akhtar bhai, if you would like to add points, please.
No, I think you have covered it very well, particularly this fortified rice that is being distributed in one of the largest programs, safety net programs in Bangladesh. It's called Food Friendly Program. And so that, the entire rice is nutrient fortified, and that is produced by the private sector. So I think, of course, their private sector also can play a big role in terms of packaging and transporting and things like that. So I think they have a big role, but you have covered it very well, Mamoon.
Thanks, Mamoon. Thank you, Akhtar, as well. Ugo, I'm going to come back to you. So the question is from Masoud Lazreg, a researcher from Algeria. Please, how can export restrictions affect food security in net importing countries during the pandemic?
I think there is such a wealth of expertise in IFPRI for that question. I think there is. Thank you, Masoud, for the question. I think there is historically a tendency to restrict trade in times of crisis. So something that we have seen in the past in 2009 and 10, and something that is generally not very much recommended as a practice. There are countries that heavily depend on imports, especially if we think of some of the more fragile states. I'm thinking of even war-torn Yemen and other very fragile contexts that, and parts of West Africa that heavily depend on imported food. So getting at least some of the basic supplies still functioning, I think it's very important. Martin Ravalian wrote about it a month or so ago, and probably it's one of the factors that may really help in avoiding what might be really a risk of severe food insecurity and food security crisis, sometimes even leading to famines. So making sure that the food at least can move, and that at the same time injecting more purchasing power to people, including through social protection, that increases effective demand, and that conveys those market signals that help markets still operate and ensure some basic functionality would be, I think, an important part of the response.
Thank you, Ugo. I appreciate it. We have just a little bit more, just a few more minutes for questions. I'm going to come to Tigist. Tigist, what do you expect would happen to the food security status of PSNP participants if the COVID-19 crisis continues for many more months? And how could the SPEAR project further support the participants?
We are anticipating that if the COVID-19 effect is continue for longer period, there may be a number of households will be affected, and the number of the PSNP claims or non-PSNP claims is added on PSNP claims. So the expansion of this program, as well as extending the extension of the transfer months. For example, for public work, we are giving only 6 months. But if the problem is continue, then the government, as well as the SPEAR, has to think of expansion and also covering year-round transfer for those are PSNP claims, and for those of affected currently. Newly, they are the government as well as the NGO and other partners should think of to cover both affected people.
Great, thank you, Tigist. Jessica, I'm going to bring the last question to you. And this is a question from Gamal Alim. And Gamal has said the coronavirus lockdown has negatively affected food supply chains. And so the question is about how cash transfers are effective. How effective are cash transfers compared to food on food availability and food security, given some concerns about accessibility? So I wonder if you could just comment. This is another question on cash and food transfers, but knowing what we know about interruptions in activity in Ethiopia, could you comment on maybe what the SPEAR project should be thinking about as they go forward about the balance of cash and food transfers?
Sure. I think that's an important question. Many countries, including Ethiopia, have suspended or limited markets, in which case even households that access cash may not be able to spend it effectively or easily. Going forward, I think it will be important for SPEAR to track what types of market activities are able to continue and at what scale. It may be very different if you're looking for a market at which to sell or purchase an animal source food or a larger asset compared to a market where staple foods could be purchased. It may be that markets for staples are less affected because they're more frequent or they're smaller, in which case the implications for cash transfers might be less severe than we fear. But given more granular data about market operation and also prices, we would be able to really have a better sense of whether the effectiveness of cash transfers has been greatly diminished, such that they're perhaps not an effective modality at this time, or whether households are still able to use a cash transfer to meet kind of immediate short-term needs. Back to you, Dan.
Great, thank you, Jessica. So we've reached the end of our Q&A session. And I want to thank everyone for participating in the discussion and for a large number of questions coming in. Apologies to those who sent questions that I wasn't able to get to. I think I reached only about half of the questions that we received. So I do appreciate the interest and everyone's great ideas and contributions to the discussion. So I'd like to give each of our speakers 20 seconds for their sort of final takeaway messages. I'll go in reverse order. So just passing from one to the next, we'll start with Jessica, and then Tigist, then Akhtar, Mamoun, and then Ugo. And then Ugo, after you, it'll come back to me. So Jessica?
Great, thank you, Dan. So our preliminary evidence suggests that households in rural Ethiopia are facing significant livelihood shocks due to COVID-19. They're coping with those shocks by relying on social safety nets as well as existing savings and existing assets. So it will be very important to track the longer term effects of these coping mechanisms on households' welfare, nutrition, and their broader resilience. Next, I'll pass it to Tigist.
Tigist, you are muted.
In summary, the effect or the implication of COVID-19 in PSNP household as well as for other unrecognized pools may be higher, and this if the disease is going to be taking longer period, and better preparation is needed from both NGO as well as the government side to respond for the need of those foods. And the other point I wanted to make here is the implication of this COVID. Now it's only recognize the early effect. So the adoption may need to cover larger portion of the implementation component. So the government as well as our SPEAR program has to revisit and see to respond and make more modification. Thank you.
Thank you, Tigist. And now we go to Akhtar.
Thank you, Dan. In Bangladesh, we must consider innovative approaches to protect food security and nutrition during COVID-19. This can include distribution of food vouchers, which we do not have, and combining safety net transfers with nutrition knowledge. Bangladesh achieved the fastest drop in child stunting among developing countries. But this progress is now at risk, so we must urgently rethink our approaches. Over to you, Mamun.
Thank you, Akhtar Bhai. I think while protecting nutrition remain a challenge, we continue to explore innovative approaches to safely and effectively prevent malnutrition, particularly among women and children. There are many opportunities for the government, private sector, and development partners to work together to fight against this global pandemic. And use of technology, as I mentioned, to connect, reach out, and improve the nutrition of the most vulnerable during this critical time. So thank you, and over to you, Ogo.
Thank you. 60% of cash transfers programs are new programs introduced for the crisis, mostly for 3 months. And what this says is that these programs are filling some structural gaps, both at the bottom of the distribution as well as the middle of it. These programs help, but my message is that they are a temporary solution to a structural problem, and that we need to shift social protection somewhat to a new equilibrium in a way that addresses those structural issues. And this will serve countries well in normal times, as well as establishing a pipeline for crisis support during pandemics and other crises.
Thanks very much, Ugo. I want to thank everyone for joining us for this important discussion. Please visit IFPRI's COVID-19 Spotlight page at ifpri.org, where you can find related research, analyses, and blogs, or just Google IFPRI and COVID-19 and you'll find a lot of information there. Keep well and stay safe, everyone. Thank you and goodbye.